Hi, everyone. My name is Jim Arbogast. I'm a scientist with Gojo Industries, the makers of Purell. I'm really excited today to talk to you about the implementation of an effective hygiene program. We're focused on education settings today, but I'm going to tie it into really applicable things for everyone. And you'll be hearing this on May 19th, so we're still in this pandemic with COVID-19. But again, what we're talking about today, these best practices are applicable not just to COVID-19, not just to influenza or other respiratory illnesses, but to really all things that can cause illness in school: E. coli, MRSA, salmonella, et cetera, et cetera. So, all right, let's get going. Just a personal disclosure up front. I want to let you know that I'm a scientist. I focus on advancing the science at Gojo. I've been working on our products, Purell, Gojo, and Provon, since 2002. Before that, I was with Dial, and that's where I got interested in hand hygiene and skincare and personal care. And before that, I was with Clorox. So I do work for industry, but I want to tell you that industry isn't necessarily bad. We're not always biased. And I can guarantee you that our motivation is to advance the science, do that in high quality manners, well-designed studies, controlled studies. We use these studies to advance our knowledge, to support claims, to draw valid conclusions and results. Oftentimes we'll do pilot studies to just get our learning and help us think about larger studies. It's all driven towards public health. We collaborate constantly. Really, that's one thing I love about what we do, is working with thought leaders around the world: World Health Organization, CDC, Health Canada, academic thought leaders, experts in norovirus, experts in other types of infections, infection prevention, and healthcare. So, and I do want to tell you that skincare and environmental surface products are regulated. They're regulated differently by country, which makes it challenging, and they are complex regulations, and they're complex subjects. So I encourage you to ask questions, and I'll give you contact information at the end. Don't be surprised if I say, or Gojo says, well, I'm not sure, we've got to look into that or think about that. Some of these, there's still a lot unknown, and that's very motivating as we try to advance hygiene and improve public health outcomes. All right, let's get into the meat of the content. The objectives are to provide guidance for what is a highly effective hygiene program in school settings, reducing the risk of getting sick from germs for teachers, staff, and students, really anyone that goes into a school setting. We'll identify the basis for this, published hygiene guidelines and recommendations and tools that support why we're providing these recommendations, best practices. Hopefully by the end you'll understand those best practices and have resources that you can apply and share with others, and hopefully get some learning out of this on how hand hygiene and surface disinfection is really important and valuable to reduce the risk of getting sick in these education settings. So the foundation here, especially for hand hygiene, I'm showing on this slide different hand hygiene guidance documents. We've got the one from Health Canada over on the left. Over on the right, the US CDC updated their hand hygiene guideline for healthcare in 2002. That was really the first major change in many decades, and it flipped the recommendations from soap, hand washing, and gloving only to alcohol-based hand sanitizer as the primary intervention, and washing hands when they're visibly soiled. And then in 2009, the World Health Organization put out their updated hand hygiene guideline, and I'll be referencing that quite a bit. That was a global effort. It was a group of many thought leaders. I don't know, I think about 100 thought leaders that met regularly. It was a 5-year effort, and that guidance document is fantastic. I'm not showing surface disinfection guidance documents here, but there is, again, a lot of guidance there that this is based on as well. So in Health Canada, there's some resources around hand washing and hand hygiene. So provide a link here, but you can see that when you go into this, they talk about the benefits of hand washing and hand hygiene and how to protect yourself and stay healthy. In the US, the CDC issued the Clean Hands Count campaign in 2016 and then updated in 2019 to be in Spanish and expanded it out to broader settings in healthcare, for instance, nursing homes. That's really directed at healthcare, but I think it's very applicable to school settings. They have simple brochures, fact sheets. They address myths and misinformation in plain language because they're directing a lot of this towards patients and visitors. And really, in any building, there's visitors. So the basics here of guidance are really foundational, and they can be applicable to all settings. And then in 2019, the CDC updated their Life is Better with Clean Hands program as well, and there's resources there. So what are the relevant best practices from Health Canada and CDC? I've got this summarized here. If hands are not visibly soiled or contaminated with organic or proteinaceous material, as we say on the slide, an alcohol-based hand sanitizer is effective and recommended. In healthcare settings, there's specific moments, there's key moments, they call them my 5 moments, where you really want to clean your hands before any invasive procedures, before and after any patient contact, and whenever the hospital can have special indications. Most of the time it's entering and exiting rooms. And I think that's very applicable to school settings as well. We'll talk more about that later. If hands are visibly soiled, the best practice is going to be using soap and water. The alcohol-based hand sanitizer will still kill germs, but it won't remove that soil. It's really important to advise everyone in that setting of the importance of hand hygiene. Luckily, it's not a complicated subject. There's a lot of science and depth to it, but the key messages are very simple to understand. And I've seen many schools, even with kindergartners, first graders, second graders, young students can get this and learn, and it's really important that they understand why they're cleaning their hands and doing it at key moments. And then you want to select disinfectants, surface disinfectants that are approved. In Health Canada, they require a drug identification number. They do a great job of making sure that they're approved for the indications, for the claims they're making. And I'll hit on this later, you really want to make sure you are following the manufacturer's instructions. I'll talk more about that later. All right, so we're transitioning now into a little bit of depth on hand hygiene. And first I want to just set the foundation, both for hand hygiene and surface disinfection. The whole game we're playing here with hygiene is to reduce the risk of infection, break this chain of transmission. The germs on the upper right, the 2 groups that we're most worried about in most developed countries and buildings are bacteria and viruses. There's many viruses, many different bacteria that can get people sick. When people do become sick, they become the reservoir. And unfortunately for us, many of these germs can live for long periods of time on surfaces out in the environment. Norovirus, for instance, is stable for months in the environment. So they can get out. They usually come out through our mouth if we sneeze, mouth or nose if we sneeze, or the reason we have such an emphasis on hand washing after using the restroom is that germs can be transmitted through feces. And then they can transmit around on the left. They get around 2 people, and a big thing is to oftentimes people infect themselves. So over on the left, how germs get in, the portal of entry is often the mouth, eyes, or nose. Touching your face is a habit that you want to try to avoid, especially when your hands aren't clean. So luckily for us, we can break this chain of transmission with simple practices at key moments. So hand hygiene and surface disinfection are 2 ways to do that. After you use the restroom, I'm in the bottom right corner, after sneezing, after touching frequently touched surface, those are good times for cleaning your hands. Over on the left side, you can break that chain by cleaning your hands or surfaces really at key moments. A couple that come to mind in school settings are in the cafeteria, cleaning the table where the students or staff are eating right before you eat is a good way to reduce the risk that you can get something on your hands or on your food from that table. And then cleaning your hands right before you eat is another way that you can reduce the risk of getting sick. Imagine eating a sandwich, your fingers touch that sandwich and then that sandwich goes into your mouth, or eating an apple or other finger foods. Okay, another foundational thing is that the products that we're developing, really the whole industry should be thinking about this. I think at Gojo with our Purell products, we spend a ton of time on getting this right. In the upper left, we've got cleaning or reducing germs, antimicrobial efficacy. That can be on hands or on hard surfaces. That's foundational. You've got to deliver on that because that's the purpose of the product. People are cleaning their hands to reduce the germs, cleaning the surfaces to reduce the germs that can get you sick. Up in the upper right, skin health and surface compatibility is another critical component. So you at least cannot damage the skin or damage the surface. Ideally, the products that you're using, the products that we develop for Purell, are going to improve the skin condition. And with alcohol-based hand sanitizers, we actually know that when they're formulated well, they can and they do improve skin condition. One of the hardest challenges with hand washing is making a mild soap, especially if someone washes their hands quite often. So we'll talk more about that later. And then the last thing at the bottom, the user acceptance, the user experience, the sensory experience, how it feels, how it smells, how it feels the first time you use it, how it feels if you've hand sanitized 10 times in the day, making sure it's not tacky, causing slipperiness when you touch other things, just that whole experience, the delivery system, how it comes out of the package, how much comes under your hands or how it sprays out. All of that's really critical. And I would say that that experience one is probably the most important, because if people don't like the product, they won't use it. In the title here, we mentioned driving hygiene compliance. Compliance is a term that's used in healthcare and public health settings. You're really being compliant with following the policy of cleaning your hands or cleaning surfaces at those key moments. So you've got to get all three of these right. I say it's a three-legged stool. If you don't deliver on any one of these three, there's going to be a problem. Okay, let's move into some best practices for K through 12 on hand hygiene, K through 12 and higher education. And again, really this is applicable to all settings. It's really fundamental based on a really big body of evidence and great science. So practicing good hand hygiene in schools, washing and sanitizing your hands is the first line of defense. And doing that at key moments using the alcohol-based hand sanitizer and surface disinfecting products really does reduce germs. And it's important to know and be conscious of where your risks are. And it's really in frequently touched or commonly touched surfaces. So I mentioned tables before, door handles, sporting equipment gets shared, restroom surfaces, just a variety of surfaces here that you want to be conscious of. And I know, you can't clean every surface all the time. So it's about reducing the risk and cleaning them at key times, and cleaning your hands at key times. All right. Steps to implementing an effective hand hygiene program. This is really borrowed from the World Health Organization, what they call a multimodal strategy to improve hand hygiene. And they guide every healthcare system. You must have these to have sustained improved hygiene. Luckily, it's not that hard. A culture of safety really means that you have leadership support. They believe in hand hygiene and surface hygiene. They provide the resources, the tools, and role model so that it's part of the culture to clean your hands at key moments. Number two, education, training, and feedback. This can be very, very simple. Just basic education on how to clean hands, when to clean hands, why it's important. We've got resources and tools to help with that. Highlighting those key moments like after coughing or sneezing into tissues or your sleeves. Those are times to have good practice, good habits, both for sneezing. You should sneeze into a tissue or sleeve, not onto a surface, and then clean your hands right after that. And then in the healthcare world, they say just-in-time coaching, provide feedback. So in a school setting, that could be as simple as reminding a student or a colleague, hey, you're eating your food now. This is a really good time to clean your hands. If you see someone that hasn't cleaned something or got a surface dirty and they didn't clean it, that's a good time to remind them to do that. Number three is providing safe and effective products that are accessible, well tolerated at the right locations. We strongly recommend putting the dispensers, for instance, alcohol-based hand sanitizers dispensers, in the normal workflow, in the normal school flow, we say here. I like to think of entering the building as a key time, and most students are wearing backpacks coming in, their hands are free, they can use the alcohol-based hand sanitizers, they go into the building, on their way into the cafeteria, clean their hands on the move, very convenient, especially if you place them in key locations. Doors, near doors in classrooms is another good location. And then number four, reminders in the workplace. Reminders in the school, oftentimes that's posters, a teacher cleaning their hands at key moments in front of students is role modeling, having these simple reminders. Also, don't forget to change out the posters. If the same poster is in the bathroom or on the wall by the bathroom for decades, for many years, usually it stops being noticed. And again, there's easy ways to do that and put those reminders in the workplace. Okay, so I've got some tips now for hand hygiene in schools. We've called out the key moments here just to help you understand, the most important times to clean your hands: whenever they're dirty, before eating, after using the toilet, after contacting surfaces that could be contaminated, such as garbage bins, cleaning cloths, etc. In Canada, you want to look for the hand sanitizers that are approved by Health Canada, and that requires a natural product number. That's the regulatory system that's used. I want to mention refilling of products. We often in the industry call them bulk dispensers, bulk hand soap dispensers or bulk hand sanitizer dispensers, where you can open the top of it and pour in the soap or the sanitizer. And we've seen this happen quite a bit in sanitizers during the pandemic, because early on there was a shortage of products. Now we've caught up and the industry's caught up. These refilling practices can be really unsafe. They don't meet regulations, and they create risk. They create, safety risks in a couple of manners. With an alcohol-based hand sanitizer, the alcohol is evaporative, so it evaporates. These systems are usually not designed to be airtight. The bulk systems, I should say, the Purell and Gojo products are designed that way. We use sanitary refills, but if you have a poorly designed dispenser, the alcohol can evaporate and then it gets below 60% alcohol, which is critical for it to kill that broad spectrum of germs quickly. Also, mixing of products can cause the products to be unstable. Two different soaps usually don't mix well, so you'll get things that settle in the bottom, eventually form biofilms. Germs can grow in the soap, so it's just really a bad practice. And we strongly recommend that you follow the manufacturer guidance on the products. We put a lot of time and effort and thinking into the labeling and the guidance to make sure you have a good experience and you get the results you want. So washing your hands for 20 seconds over on the right is a key thing. 10 to 20 seconds is what I'd recommend, and using an alcohol-based hand sanitizer that's above 60% ethanol alcohol. We use and focused on ethanol because of that experience. It's got a less odor than isopropanol, which can also be effective, but usually very polarizing. On this next slide, I've got the different ways, the techniques of cleaning your hands, and we've got resources here with an alcohol-based hand rub. It's just putting on a proper dose, covering the hand completely. You want to make sure you get the fingertips especially, the palm, the places that you touch things with. Hand washing, we've got a 5-step process there. Again, not hard to understand. Students will be able to get this. Want to make sure that you are using well-formulated hand sanitizers and soaps and skin conditioners, especially during cold months. The soap can be hard on the skin, and you want to, and the environment, cold, dry weather is just really tough on skin condition. That's a good time to use hand lotion. So that will moisturize your skin. I especially recommend that at times where you know you're not going to be using your hands much. So right before bed is a good time, maybe right after eating, at the beginning of a class period might be another good time to use hand lotion. All right, let's talk a little bit about surfaces now. Don't forget cleaning those surfaces and disinfecting at key moments. In school buildings, there's a wide variety of surfaces that get touched. Doorknobs, handles, desktops, etc. Toys may be shared, sporting equipment may be shared, and these germs can move from hands from one person to surfaces, then to the hands of another person, and then if they touch their face or their food, they can contaminate themselves. So over on the right, we've got the simple mode of transmission. Someone's sick, they get germs in the environment, you touch a surface that's been contaminated. Pathogens there is a fancy word for germs that can get you sick, and people spread those pathogens to others, sometimes through skin-to-skin contact as well. So wrestling mats and wrestling is one example where there's a lot of skin-to-skin contact. All right, I'm going to take a minute or two on this slide. Successful cleaning, surface cleaning products. You want to choose products very carefully. Read those labels. If you take one thing away from this, really look at the labels, especially on the surface products. Many of them will recommend that you keep the surface wet for 5 or 10 minutes. I've even seen 15 minutes, which is just crazy. In most environments, that's just too long to be practical. You want to look for a broad spectrum of germs, that it's killing a broad spectrum of germs. On the label, it should state this, and it should have contact times. I'd shoot for 30 seconds. 30 seconds is usually, in most countries, the shortest claim that you can make because of the test methods. You want to look for products that meet the Health Canada regulations, the DIN number, and during this pandemic, we're reminded that coronavirus, look for the claims to make sure the product kills coronavirus. And then at the bottom here, mention creating a cleaning and disinfecting procedure. So clean the surfaces and especially those surfaces that get touched frequently at key moments. I forgot to mention, I'm just going to mention the safety is another important thing to read on the labels, the warnings and safety guidance on the label. Many products will say that you should wear gloves while using the product, or you should immediately wash your hands after contacting them. And I'm really proud of the Purell surface disinfectant, the surface spray there shown on the right, because it is very safe. We don't have any of those warnings. It even is approved for no rinse food contact. So it can be used on surfaces that, like a cutting board, and then not rinsed off because it's so safe. You can cut your food right on that surface after you've cleaned it and then eat your food safely. All right, I'm on the last slide, conclusions. I think I've hit on a lot of these already. Break that chain of transmission with hygiene. You want to have routine practices to reduce that risk. Proper hand hygiene at key moments is a really healthy habit and easy to do, especially if you use the right products and put it in the school flow. Clean and disinfect those surfaces at key moments, and you want to provide products that are properly approved, they're well formulated, they're friendly for either the skin or the hard surface that you're cleaning, and they're practical. The last thing I want to say is I'm not trying to turn anyone into a germaphobe. Germs are good for you, and we are, we're not trying to sterilize the environment. We're trying to reduce the risk of getting sick. We do that by taking the germ load down through hygiene so that your immune system can handle it and keep you healthy. So last, I've got my contact information. Please feel free to contact me. I've got email and my mobile number there. And then at Gojo, we have a technical information process, an email box, the tip@gojo.com. Feel free to send questions into there as well.